If you're thinking about having weight loss surgery and you're at the point of wondering, is it time? Am I ready? Do I need to do this? This video is for you. I've been where you are, and I'm going to walk you through 6 personal self checks that you can do to help you make this decision. This isn't going to be a list of medical requirements, although I will touch on that. But these are questions that you can ask yourself to know if you're mentally and emotionally prepared and if it's time to go ahead and pursue weight loss surgery. So my name is Sean. I used to weigh 304 pounds. I dieted all my life, and I finally had a mini-gastric bypass in March 2022. I've lost 140 pounds, so about 88% of my excess weight. I'm a health journalist, and now I help people who are thinking about bariatric surgery to have a smoother process and save time and money. So let me start with my story. As I mentioned, I've been dieting all my life. The first time I went on a diet, my mother took me to a registered dietitian on a military base. I was 7 years old, and I've been dieting ever since. And I tried everything. I was dieting even as a kid. I tried the Atkins diet. I tried South Beach. I tried Weight Watchers a bunch of times. I tried different trainers. I took up cycling. I became a competitive swimmer, and I would lose weight in the summers when I was in the pool. I would just drop weight. And then when it was off season, I would regain it. So even at a young age, I was doing this yo-yo losing and gaining. As an adult, I went through the same thing, just trying different diets, working with trainers, losing and gaining. I became the diet editor at Health Magazine, and at the time I was maybe about 230 pounds. And this is how I found out about bariatric surgery. One of my editors came to me and said she wanted me to do a long story about bariatric surgery, a feature story. And so I started researching it and learning more about it, talking to surgeons, talking to patients. And at the time, I had just been diagnosed with pre-diabetes. And in the process of reporting the story, I learned that bariatric surgery could help with type 2 diabetes. And I told myself, if I'm ever diagnosed with type 2 diabetes, I'm going to get bariatric surgery. I didn't do it then because it was intimidating. Even though I'm medically qualified, like my BMI was high enough, it just sounded so drastic and permanent, and I wasn't sure I wanted to take that step. And I kept believing I could do it on my own because I was the diet editor at a national women's magazine, right? I had access to all the diet books. I had access to all the medical journals. I interviewed the nation's top obesity experts on a regular basis. I felt like I had all the resources I could do to lose weight. All I had to do, I thought, was just figure out how to have enough willpower, right? Or just figure out how I could keep all the balls in the air. If you can relate to this, drop me a note in the comment and let me know that you can relate to this. But I kept thinking, if I could just keep all the balls in the air, if I could just keep my diet consistent, if I could get all my hydration, if I could exercise 4 or 5 days a week, if I could keep it all going all at the same time, maybe I will finally keep the weight off. And I still kept going through this losing, gaining. Finally, 10 years later, I weighed maybe about 290 pounds. My primary care doctor diagnosed me with type 2 diabetes. And she said, I think you should think about weight loss surgery. And I remembered what I told myself 10 years before. And that's when I started pursuing weight loss surgery. It took 2 years from the time that I made that decision to actually getting in the operating room because there's so many obstacles. But if I had 10 years earlier pursued it, I might have saved myself having sleep apnea, having high blood pressure, doing damage to my knees. I've had to have knee replacements. I was just intimidated. And so I want to make this video so that way you have some questions that you can ask yourself to know, are you ready? Okay, let's get into it. Let's first talk about medical eligibility for bariatric surgery. There are 2 organizations of bariatric surgeons that came out with joint guidelines in 2022. The first one is the ASMBS, the American Society for Metabolic and Bariatric Surgery. The other one is the IFSO, the International Federation for the Surgery of Obesity. They came out with joint guidelines. Those guidelines don't always jive with what insurance companies' thresholds are, but these are what surgeons recommend. The first is anyone with a BMI of 35 or higher, whether or not they have coexisting conditions. The second is for people that have a BMI of 30 to 34.9 and who have some type of metabolic disease. The third one is also for people who have a BMI between 30 and 34.9. And for this group, people who may not have a coexisting condition, but who have tried to lose weight through non-surgical methods and haven't been successful at losing a substantial amount of weight or haven't been successful at keeping the weight off. These two organizations also recommend adjusting the BMI threshold for different populations. So, for example, for people who are Asian, who have Asian heritage, they recommend a BMI of 27.5 to begin considering weight loss surgery. So those are the medical guidelines. And I want you to understand that just because you're eligible for bariatric surgery does not mean you're a failure. If your BMI qualifies you, don't assume that it's because you let yourself go, you let yourself down, or that you don't have enough discipline or willpower. None of that is true. Obesity is a chronic disease. It is both progressive and relapsing. It's a very complex disease. And you deserve medical care for a disease just like someone would for any other type of disease. So it's not about your willpower. It's not about your discipline. It's about biology. All right, so let's get into these 6 questions that you can ask yourself as you're deciding whether or not you're ready for bariatric surgery. And again, these aren't questions you need to go take to a doctor's office. These are questions for you to decide whether or not you are ready and whether it's time for you. The first question, do you have access to unbiased, accurate information about obesity and weight loss surgery? This is going to be important for you so you can make an informed decision about what's next for you. Let's talk about your primary care provider and the other care providers that you have around you. A lot of care providers don't understand that obesity is a chronic disease that needs ongoing medical care. Sometimes care providers only respond out of what they know, and sometimes it's rooted in weight bias. Sometimes those care providers can misinform you. Sometimes they're dismissive. Sometimes they're gaslighting. Sometimes they're shaming. So really look for red flags. If you have a care provider who's telling you you just need to diet and exercise, you're not trying hard enough, you need some discipline, this is your fault. Drop in the comments. I've had that happen where a doctor told me it was my fault. That is not true. Obesity is a chronic disease. Those are red flags that you need to go find another primary care provider. You're going to need a primary care provider who's compassionate and sympathetic and who understands what obesity is, not only as you're making this decision, but through your surgery journey and then after for the rest of your care for life. In fact, a lot of bariatric surgeons are going to want some kind of letter from your primary care physician that they acknowledge that they're going to support you if you have bariatric surgery, because they're going to be part of your follow-up care. Like they may need to do blood tests to check that you're getting good nutrition, and they might have to do other checks along the way. And then there's just other ways that bariatric surgery can impact your health going forward. So you need to have a primary care physician who's going to be supportive. All of this is about building a support team around you. You're entitled to that. You are entitled to medical care for obesity. Apply this to any specialists that you're working with. So you want to make sure all of the specialists that you're working with are supportive of you having bariatric surgery and that they are willing to support your care if you do have bariatric surgery and going forward. That leads me to the next question you can ask yourself, and that is, do you have support or do you need help finding support? So think about the people that are close to you in your life, your family, your close friends, your medical providers. Just like I mentioned earlier, if your medical provider doesn't support your decision to treat obesity in a way that is based in science, then you need to find another care provider. Think about your family and your friends. Do they support your decision? That shouldn't be a make or break. This is your health care. This is your future. So you need people who are going to support you in your pursuit of good health. Think about whether or not the people around you are willing to learn and willing to support you. And if they aren't, then find people who will support you and who do understand and who are willing to listen to what you're experiencing and the decisions that you're making. You really do need that support going forward because, unlike what a lot of people say, bariatric surgery is not the easy way out. It's a journey and you will change your life, and you need people who will support you in doing that. All right, let's talk about the third question to ask yourself as you're making this decision on whether or not it's time to have bariatric surgery. Ask if you are willing and feel capable to advocate for yourself. You're going to have to speak up for yourself at the doctor's office. Just like I mentioned earlier, sometimes you might run into weight bias in the doctor's office and the healthcare system. You might have to advocate for yourself as you're trying to get insurance to cover your procedure. And then even after you have surgery, you're going to have to advocate for yourself. You might have to advocate for accommodations in your workspace, in your work life, when you go out to eat, just to kind of make yourself have the room you need to support your health and support your lifestyle and your goals. So really think about what it takes to advocate for yourself. I will tell you that it takes trusting yourself. And I think a lot of times when we've had obesity, people undermine our ability to trust ourselves. They keep saying, you don't have enough willpower, you don't stick to it, you aren't doing things right, you have a lack of control, you don't have any self-control. A lot of times we go to the doctor and we feel like something's wrong, and sometimes those care providers will say, oh, you just need to lose weight. And all of those things undermine our trust to know our own bodies, and you need to reclaim that. So really think about trusting yourself. And if you need to work with a therapist on that, do, because it will pay off in dividends. Trusting yourself and trusting yourself to know your own body and to know what you need is really important, and it's foundational to being your own advocate. Let's go to question number 4. Have you explored all the medical and financial pathways to getting surgery, or have you started? Have you started looking for surgery centers near you? Have you looked at your insurance policy to see what they will and will not cover? Have you thought about how you're going to pay for surgery if you need to pay out of pocket? Or have you thought about having surgery out of the country if you need to? So you don't have to have it figured out right now, but start looking, and that will help you determine your readiness and help you put things into action. And sometimes you might need help with all of that, and that's okay. Question number 5, are you ready to care for yourself in a new way, both physically and emotionally? I will tell you that especially the first year after surgery is a big journey. Even if you've been dieting and exercising for years before you have had your surgery, having surgery is going to be different because you're going to have to eat differently. Your stomach is going to be brand new, and you're going to have to learn your stomach all over again. There may be things you can't tolerate anymore. Your taste buds might change. So you might have to find new foods that you enjoy eating. You're going to have to really tune into your body and pay attention to it in new ways and follow new dietary guidelines. You're going to have to learn how to chew your food a little bit more. You're going to have to learn how to take smaller bites. So think about your readiness to take care of yourself in new ways. Okay, that takes us to question number 6. It's a natural segue. Are you ready to adapt? Again, you might be able to eat the things that you ate before, not just because you are trying to lose weight, but because you might not be able to tolerate certain things. I think it really helps to give yourself a lot of latitude, both in terms of being flexible and willing to adapt, But you also need to be able to do that financially, because when you buy some things from the grocery store that you used to love and then you realize I can't tolerate that anymore, you're going to need a little bit of wiggle room in your grocery budget to try new things and figure out what you can tolerate and what you can eat, or how you can meet your protein and other nutrition goals. So be willing to adapt, and think about, are you willing to adapt? Are you willing to be patient with yourself? That's a huge one. The patience not only is in learning how to eat and learning how to exercise, but also with weight loss expectations. A lot of people go into bariatric surgery and expect to lose a lot of weight in the first days and months after having bariatric surgery, and it doesn't all come off really quickly. I think a good mindset to have is to think of this as a 2 or 3 year journey, especially if you're planning to have skin removal afterward. Think of it as a long-term transition. All the weight is not going to come off in the first couple of months, okay? Just be patient with yourself and be patient with your body. Your body's going to need time to heal and recover after the surgery, and the weight loss may be slow in the beginning, but just be patient with yourself and really think about now, are you willing to be patient with yourself? And are you willing to think of this as a long-term transition? It's going to take some time. It will happen, and the rewards will be worth it. I'm so glad that I did it, but you're going to have some patience with yourself. Okay, so those are 6 questions you can ask yourself to determine whether or not you feel ready and whether or not you feel it's time to have weight loss surgery. I have a couple of things that will help you. Number one, if you look in the video description, I have a website called the Bariatric Surgery Explorer. And this is a website that you can use to explore and compare different procedures and learn more about them. And then there's a cost comparison tool. So you can compare the cost of different procedures, like if you want to compare the cost of a sleeve versus the cost of a bypass. So you can do that. It's all ballpark because every surgeon has their own prices, but you can get a good idea of what you might pay. And then not only can you compare procedures, but you can compare costs in different countries. So you can compare the United States to costs in Mexico to costs in Turkey. So that's one tool that you can use, and it's free to use. The other thing is that I offer one-on-one support calls. So if you like this information that I'm sharing, but you want to save time and maybe even save money, you can go to the video description. I have a Calendly link. You can find some time that works for you, and you can even let me know what you'd like to focus on in our call. We'll have a 1-hour call, and we'll focus on what's important to you. And then at the end of the call, I'll give you a recap of everything we discussed. I'll give you some links to some resources, and I even have a couple of bonuses for you. And this will be your roadmap to planning your surgery. If I had had the kind of support that I'm offering in these calls, I probably could have shaved a year off the time it took me to have surgery. It took 2 years from the time I decided to have surgery to the time I actually got in the operating room. And a lot of that was just like navigating all this non-medical stuff. And so I really want to help people navigate all of that. So that's what these calls are about. So if that's helpful to you, you think that that will really help you, you can book some time. I'm going to ask you, if you're still with me, to do me a favor. Would you please subscribe to this channel? And the reason that I ask is because I'm really passionate about helping people get the care they need to address obesity. And if you subscribe to this channel, it will let the YouTube algorithm know to show this to more people who need to see it. I would really appreciate that, and you'll be doing somebody a favor. Thank you so much for watching, and I wish you all the best in your journey.